the basics, touch on the basics of Medicare, and then also towards the end, we'll talk about some of the potential cost increases and some of the changes that are happening for Medicare as a whole and how it affects plans like supplementals, prescription drug plans, and Medicare Advantage plans. So first of all, my name is Mike Andrews. I'm a local licensed agent, independent, so I'm not with one specific carrier. I work with most of them, if not all of them, in Connecticut. And I also have a nursing background. I was a nurse for the past 9 years. I did medical, surgical, night shift, never got used to that. I also did home care for a while as a case manager. And then I did my last 3 years as an orthopedic nurse and looking to go back per diem in the winter time. But for now, I'm just focusing on open enrollment upcoming fall. So just a little bit about me. This is my family. So my wife Laura's in the top left, and then all those little pictures of that little girl there are my daughter. And then at the bottom right, those are my grandmother's on the left, and Laura's grandmother's on the right. And they're both in their 90s, still doing pretty well. So we're very blessed to have them. So basically, how I help is I find a plan that fits your needs and preferences. I continue to be a trusted and unbiased resource for Medicare. So I review with all my clients or anybody that's needs a review during open enrollment. I'm licensed with all the major carriers in Connecticut that include the ones that you see right there. Aetna, United Healthcare, Anthem, Care Partners, Cigna, WellCare, Connecticut, and Humana. And my services are no cost to you. So first of all, with Original Medicare, it's a government health insurance program that's specifically for people that are 65 and older, or if you're under 65 with a qualified disability. Original Medicare does cover many of the healthcare services, but there are many cost gaps. And one caveat for Medicare is that there is no maximum out of pocket for your healthcare costs. So most people, when they turn 65, they have a decision to make. They either take Medicare or stay with a employee insurance policy. So your initial enrollment period is 3 months before, the month of, and 3 months after your 65th birthday. And like I said, if you're working for an employer that has 20 or more employees, or perhaps you have a spouse that you're getting health insurance from, uh, you may or may not want to go into Medicare at that time. And that's something that I can help you figure out. Sometimes it's more cost effective to go on Medicare, and sometimes it's not. However, if you are getting health insurance through the ACA, the Affordable Care Act, Access Health CT, or if you don't have health insurance at all, or if you say have Medicaid, then you need to take Medicare, because in those circumstances, Medicare would have to become your primary. And those are just rules that were established by the government many years ago, and not quite much has changed, except for a lot of the costs, unfortunately. The easiest way to apply for Medicare nowadays is really through the Social Security website, which I help with that as well. It's really not a difficult application, but you want to make sure you click the right yes and the right no when you need to. So just like anything we don't do in our life, we don't know how to do it. It seems difficult. But anyway, so if you're going to continue to work and you're past 65, again, you don't have to go onto Medicare. However, if you work for a smaller employer and they have less than 20 employees, you would have to take Medicare because it would become your primary insurance, which can kind of be an issue for some people, especially if they have a younger spouse or they have children or young adults still on their health insurance plan, but they work for a smaller company. So a lot of times those individuals have to pay for Medicare and for their regular health insurance, but it's not quite common. You can basically get off your employer insurance at any time after 65. However, when you do that, there's a certain time frame of 63 days where you can, 8 months after losing coverage, that you can go onto Medicare Part B, but you only have 63 days before you can choose a drug plan or a Medicare Advantage plan. So what can happen is you apply 8 months later on, you can possibly get your Part B, but you would not have a prescription drug plan and you wouldn't be able to get one till the fall. So it's very important. And there's a form that basically is called the N564 form. I think it might be on the next page, but it's basically prevents you from getting a late enrollment penalty with Part B. And then AEP, if some of you are on Medicare perhaps already, or if you're not on Medicare yet, the annual enrollment period is between October 15th and December 7th. So that's 7-week window, including the Thanksgiving days and the weekend days. That 7-week window is the only real time you can make any change to your Medicare plan, whether you have a supplement and a drug plan or an Advantage plan. So during annual enrollment, if you have an Advantage plan, you can choose to leave that Advantage plan and get a drug plan and a supplemental, and it would start the 1st of January. Or say maybe you have a supplement that you're paying for, but you're not really using your healthcare as much. You might want to join an Advantage plan because it's, a lot of those can be no additional cost. You pay as you go. You can do that as well. So whatever change that you make would be effective for January 1st. So whether you submitted the application in October, November, December, the effective date would be January 1st. So the 4 parts to Medicare, basically, there's A, B, and then C and D. Part A is your hospitalization, I think admission, because you're admitted to a hospital, you're admitted to a skilled nursing facility, perhaps for short-term rehab. It also covers hospice care. Part B is everything else. And I say, oh boy, because it really is everything else. It's your doctor's visits, it's your blood work, your CAT scans, EKGs, durable medical equipment, infusions, say for cancer treatments or dialysis. So you're paying 20% there. Part C, so Part C is also known as Medicare Advantage. It was never part of original Medicare. Just want to make that clear. But they coined it as Part C, and what Part C does is it basically takes the benefits that you get in Part A and Part B, and it really changes the way the copays work. So you're paying fixed copays, and a lot of those plans do include a drug plan, and sometimes you can get those plans at a lower cost, but you pay copays as you go. And then a prescription drug plan, Part D. So that's normally if you have your Part A and B in a supplement, you'll get a prescription drug plan. So between supplement, drug plan, Advantage plan, what goes with what, really just comes down to either you get a supplemental in a prescription drug plan, so a standalone Part D, or you get a Medicare Advantage plan that normally has a drug portion with it. So Medicare, we just discussed what Medicare Part A covers. Again, hospital stays, skilled nursing facility, some home health care, hospice care. Then Part B is your doctor's visits, lab work, durable medical equipment, a lot of your preventative services, which don't have a cost, but any outpatient surgeries or outpatient services are under Part B. And then usually it's just easier to cover what's not covered by Medicare. So obviously the whole cost of your care, you'll still have some out-of-pocket costs just joining A and B alone. Without a drug plan, you definitely will. If you need to use your health insurance to treat an illness or a chronic condition, you will have costs. It's not long-term or custodial care. So Medicare, it pays up to 100 days, or it gives you a benefit of up to 100 days at a skilled nursing facility. But anything after that, Medicare recognizes it as like a long-term care type of situation. It doesn't classify it as medical need. And that's usually when people start going into a spend down or like a Title 19 situation. Ancillary products, those are the extra benefits that you see on TV. Mr. Joe Namath and JJ Walker, I'm sure you guys have seen those commercials so many times, especially last year. But they talk about those additional benefits that you get. And then any care received outside of the United States, unless they're except for certain circumstances. But either way, there's usually costs if you're out of the country. So A, again, think admitting to a nursing home, a hospital, something along those lines. So for your hospital care, it's a $1,676 payment that you'll make within a 60-day benefit period, which means is that if you go to the hospital 2 or 3 times a year and they're outside of a 60-day period, you're going to pay that $1,676 each time. So it's not a yearly deductible. You could think of a deductible as a 60-day deductible because it resets after 60 days. Just an easy way to think about it. For skilled nursing facility, the first 20 days there's no cost to go to a skilled nursing facility for short-term rehab. But then days 21 through 100, that's when you start paying about $209.50 per day. And then again, after day 101 and beyond, you'd be responsible for all the costs. Part B, I always think, oh boy, because again, it is everything else. So Part B does have a deductible that is a yearly deductible, and it's only $257. So say if you were to go to say if you just had Medicare A and B with nothing else, you go see your cardiologist and let's say they charge $275 for an office visit. Hopefully not that high, but maybe. You'll have to pay up to $257. And then after that, you're going to get charged 20%. So that $300 doctor visit, you'll just pay 20% next time after paying that deductible. So Medicare Part B does have a monthly premium. It could be more depending on how much your income is, and it could be less. If you qualify for any state assistance through the Medicare Savings Program, you can have your Part B premium paid for by the state. That's also something that I help with. It's a very simple application, and it only goes by income. It does not go by assets. So they don't care if you have $1 million in the bank or if you have a nice house. As long as your income is below about $3,200, you could possibly get some assistance for paying for your Part B. And there is no maximum out of pocket. So again, if you just have your A and B card and no supplement or no other type of plan, you're really, the sky's the limit of how much you could spend for, just to give you an idea, a knee replacement, let's say it's between $20,000 and $30,000. You'll pay 20% of that. So that's about $5 or $6 grand. Don't try to take a picture of this chart. You can Google IRMA 2025. Basically, this gets recalculated every year. It does a 2-year look back to see what your income was, depending if you're single or if you're married. And, I always say the more you make, the more they take. So as you can see here, if you're filing a joint tax return and your income is $750,000 and above, you're going to pay $620 a month. But you're doing pretty good, but at that point, but that's still a lot of money to pay just for Part B by itself, nothing else. And you will also pay a Part D extra premium as well. So supplements, drug plans, advantage plans, we've heard A, B, C, D, E, F, G. So what coverage is best for me? So it really just comes down to two options, two directions. You can either get a Medicare Advantage plan or a Medicare supplement. So easy way to think about it is with a Medicare Advantage plan, you typically won't pay anything additional to your Part B premium, meaning that you can get on a plan like this sometimes for zero cost. And a lot of times it'll include drug coverage and also additional benefits that are not covered by original Medicare. And you pay as you go. So you don't pay a premium per month, but maybe you pay, I don't know, $40 to see a specialist, or you pay, let's say $300 a day for your first 3 or 4 days in the hospital, something along those lines. That's how those work. Sometimes there's a deductible, sometimes there's not, and they have a maximum out of pocket as well. So you have a stop loss just in case if you get an expensive year. The other side is a Medicare supplement. So you still pay that $185 with Part B no matter what direction you go. With a supplement, you'll pay an additional premium per month. Let's say you can get a supplement in Connecticut, maybe for between $170 and $250, depending on the plan. And then you would also need a prescription drug plan. So that could cost anywhere from, I think the cheapest one now is maybe $12 and up, but they are expected to go up quite a bit this coming year. So you have more per month that you pay in premiums, but you could see any doctor in the country. With an Advantage plan on the other side, you have a network of doctors, either an HMO or a PPO. But with a supplement, you can see any doctor in the country that takes Medicare. Don't have to worry about prior authorization, at least not yet in the Medicare world. and it gives you more flexibility if you're going to do a lot of traveling in the country. So if you're a snowbird, sometimes supplements work better for people, but you're going to pay more per month, whether you utilize the healthcare coverage or not. You're still going to pay per month for your supplement for your drug plan. So sometimes, it's really not based on, your risk tolerance as far as your health goes, and then also what kind of flexibility you want, and maybe the, extra benefits that you could get with an Advantage plan might outweigh the want for a supplement. But it really just depends on your situation, and we try to help figure that out, because not one size fits all, that's for sure. So supplemental insurance, usually, like I said, it covers most of that 20%, just to keep things simple. So if you saw that the hospital copay, that 1676, it would pay that. So if you go to the hospital, you won't get a bill. If you get any sort of surgeries, outpatient surgeries, you'll pay that $257 deductible, but then you won't get a bill for anything else. And so it's all around comprehensive coverage, but it does cost more per month. And all these supplemental policies are offered by private health insurance companies. So meaning that they are not, provided by the government. The plans have to cover, like a Plan G with, let's say, United Healthcare and a Plan G with Anthem. They work exactly the same. Sometimes the costs are just more depending on how many people are on that plan. And we always say that the costs change, but what that really means is that everything goes up every year. Supplemental costs, I know a lot of companies have increased their rates. Plan Fs for a lot of companies are getting up into the high 300s. And really the options for supplements seem to really be decreasing this past year. So we're going to expect a lot of changes with the supplements. But I will say that if you already have a supplement, the chances are you'll be okay, as far as, your rates will probably increase like they always do. But it's usually the insurance companies may not want to take on new people for their supplements. So this is just a chart, another confusing chart, but basically it's just a really quick chart that shows you what letter fills in what service of Medicare. I will say that plan G and N are the most popular. I will say that F was very popular. However, if you're born, if your birthday was 1955 and earlier, so 1955, 1956 and beyond, you would no longer get on a Plan F or qualify to get on a Plan F. So Medicare Advantage, we talked about this already as well, but in simpler terms, it's not exact, but it basically, covers your brings in your hospital coverage and your outpatient stuff into one plan. And usually they include a drug plan as well, so you don't pay an additional premium for that. They are offered by private health insurance companies, and they can be an HMO or a PPO. Often includes those extras that you hear on TV, and you pay as you go. So like I said, you pay co-pays as you go. So you get on a zero premium plan, you're still paying your Part B premium, but you'll pay as you need services. And again, many of those plan options are zero cost here in Connecticut. So Part D, so prescription drug coverage. So it's a standalone prescription drug plan that you would pay for if you got on a supplement. Again, the prescription Part D would be a part of an Advantage plan if you're on an Advantage plan, and it's included in the plan. So just remember, Part D, when we're talking about Part D, we really mean that it's pairing with a supplement. So they're, again, only purchased through private health insurance companies. So like I said, A and B are from the government, but Medicare Part C, so the Advantage plans, the supplementals, and the prescription drug plans, those are all from private health insurance companies. So basically, it quote unquote covers your medications, but you still have co-pays for your medications. So sometimes we hear it's covered, we think it's paid for, but in reality, you can have a tier 4 medication that is covered, aka on the formulary, but you might pay, it can be anywhere from 20 to 30% or even more sometimes of the cost of the medication. I don't know if you're already on Medicare, you're probably aware that this year, started in January, the Inflation Reduction Act capped everybody's max out of pocket for prescriptions to $2,000 for the year, which helped a lot of people that were on a lot of expensive meds, but it also found that a lot of people that maybe were on some generics or maybe one name brand drug, their costs went up. So it helped some people, but it also didn't help others. And again, going 63 days without coverage when you're initially eligible, whether you're turning 65 or retiring after 65, after getting off employer coverage. If you're going to go 63 days, you will get triggered with a late enrollment penalty. And honestly, it sounds really bad, but I have a client that somebody I'm working with, and their late enrollment penalty is only $1 and some change a month, but it is lifelong. And why would you want to pay that if you don't have to? So the Medicare Savings Program, this is the program that I was discussing about earlier about paying for your Part B premium. So the income limits to get some assistance for that pay your Part B, and also assistance for paying for your prescription medications. If you're single and your total income, gross income, is less than $3,209 per month, or if you're married, your combined income has to be less than $4,336. If they are, you would qualify for the program. Doesn't make much sense to me why the married amount is so much lower as to compared to being single, but that's just how they decided to keep it. And again, it helps pay your Part B premium. It would help pay for prescription medications. And it's a great thing for people that have a lower income that were on Medicaid before and that no longer will qualify for Medicaid once they turn 65. So this program is here to help them. So that's me again. I'm here to answer any questions that you have. I will say if it's something very specific, that might take longer than like a minute to answer, feel free to reach out to me, even if it's just a question you have. And honestly, if there's an agent that you're working with and they review with you every year, I highly recommend you stay with them, or you make sure you review with them if they reach out to you, especially if they've been working with you, because this year, really, we're not going to be surprised if certain companies decide to discontinue certain Medicare Advantage plans. And I know that sounds horrible, but really what that means is you could still choose a different Medicare Advantage plan. It's just that between the Inflation Reduction Act and then also the new administration, government cuts, it's a trickle down effect. So, I would say that as far as any updates go for this coming year, just make sure that you're reviewing your drug costs. A lot of the plans, they're going to be restructuring so that way they can, get as much as they can for your, to reach their $2,000. But I'll say that if you take generics, you'll be fine. If you take a name brand, you'll probably be okay too. And just review your plans. And then pay attention to your mail, please. Anything you get, even if it's an advertisement, obviously you just skim through it and throw it away. But if say if you're on an Advantage plan with a specific company and you're getting a letter from them, please open it. Open your annual notice of changes. You guys will be receiving those probably towards the end of September. It's towards the end of this month. It's called an ANOC, and it goes through all the different, price increases, or if they're adding a benefit or discontinuing a benefit. You want to go through those and reach out to your broker or myself when you do get that letter, and we'll help you explain it and also figure out if you're better off staying where you're at or if it would be a good decision to possibly move your plan. So I'm a non-biased agent, so I will tell you what your best option is, even if that doesn't mean that you'll become a client of mine. So I just want everybody to know that. My phone number is down there. You can call or text, and also my email. And if you got anything out of this, I hope you did. But just another thing to look out for is the Part B. The new Part B premium will be announced sometime in late October, possibly November. So if you're getting Social Security and your Part B is getting out of your Social Security, you'll receive notification about that. Does anybody have any questions? There's probably a lot that I could talk about, but I figured I'd let some of you possibly ask some questions.
I'm gonna stop recording, and there are some questions in the, chat.
Oh, okay.